How many partners have you
I
had?
lost count at 200.
If you've been taking too many risks in the bedroom,
Condom use?
Level.
have a burning question you want to get to the bottom of,
Does a male anus enlarge like a vagina?
or need a checkup down below,
Just do a swab from the back passage.
then this is the clinic for you.
Oh my God, who is that small teen?
This expert team, Kevin,
How can I help you today?
Sarah, and one more swab, and Naomi
You've only ever had one testicle.
will tackle all your sexual health needs.
My foreskin is getting really tight.
Whatever turns you on,
I like spanking.
Fisting.
A woman asked me to piss on her.
Okay.
and reveal the eye-watering truth that conquests can have consequences.
That looks like a genital wart.
Checking in to get themselves checked out.
I've got a high sex drive. I've just become this animal.
Hopefully, I'll be able to get some answers as to why it hurts when we have sex.
I haven't learnt my lesson, still not using a condom.
Morning.
Hello.
We definitely see more heterosexual couples having anal sex now, don't we? I do think there's a lot of pressure now on younger people. They feel under pressure because of porn.
Most girls are like, actually don't enjoy it, it's really painful. And other girls are like, it's amazing.
What's your name?
Khayda.
Hey, hi.
Hey.
Hello.
How old are you lot?
I'm 29.
29.
I'm gonna be the baby, I'm 19.
How old are you?
19, 26.
26.
Yeah.
So what are you in here for then?
Just being myself. There's nothing really to say.
Would you say a weird thing is that you usually do?
What do you mean by weird?
When I say weird, like it's like something that you do in the comfort of your own space.
I used to bust loads of wanks out.
Really?
All the time I used to be
All the
sat on my
time?
computer.
Jeez.
I
Yeah.
do it at least once a day.
Fair play.
If I'm extra horny, it could go up to like 3-4 times. I'm not gonna lie, I give good dick. I know I'm good in the bed, yeah. Like I always gotta get my phone quickly. I've gotta get a good video up, situate it. And you know, I get into it, like I feel like I am the person in the video.
Really?
I try to like move at the same pace, so it's like I'm moving with
like
it as well.
method wanking.
Yeah. Ooh, I like that one.
You're
Method
welcome.
wanker.
You're welcome.
Yes. And I tell you, I've literally been around Europe when it comes to boys. I've fucked a Romanian, I've fucked a Ukrainian, Polish, Italian, literally all of them. Looks like I'm going.
Okay, good luck.
All right, see you guys in a bit.
See you in a bit.
On my pelvic areas, I get like these little, I don't know if you call them like sores. I don't know what it is. I'm scared of thinking it is like some other type of sexual kind of transmitted disease.
Hello.
Hey.
How are you?
I'm good.
Good. What's your name?
Khayda.
Khayda.
Yeah.
Nice to meet you, Khayda.
Nice to meet you too.
My name's Sarah. I'm the nurse that's going to be seeing you today. Khayda, do you have sex with men, women, or both?
So men frequently right now.
Okay. So how would you identify?
Well, bisexual. I don't know, bi-curious, bisexual, I don't know. Like, I'm still looking. I don't want the fact of me being bisexual to throw off anyone, because I really do want kids. And not to say that two men can't have kids, but I would prefer if I had like the traditional, in the sense, quotations, man and woman, child. I'm playing, I'm out here in the field.
You're testing the water, yeah. You're not writing anything off.
Yeah,
You're just
basically,
seeing.
yeah.
Okay.
I just do what I do, because obviously I've always been attracted to females. Like, that would never stop from young, but certain girls, like, they always take long to kind of get to know, and I'm very impatient. I haven't got 4 months to try and get in your panties. Like, that's long. And I'm like a fuck and go type, so I just do that and I keep moving. Okay, cool. Yeah, the ass was nice. Bye. Do you know what I mean? Like, that's it. Like, nothing more, nothing less.
So when was the last time you had sex?
So 3 weeks ago.
3 weeks ago. And you were top?
Yeah.
Okay. And was that with a casual partner, someone you know, or a one-off?
It was a hookup.
It was just a hookup. Okay, fine.
I used to do a lot of unprotected sex before.
Did you?
But now I've been starting to use protected sex, so it's changed now.
Okay,
But
fine.
I'm not gonna lie, the last 3 sessions I haven't.
Okay.
But I brought it though.
So you always bring it, but you don't always
Yeah,
get around to...
things escalate quickly. There's
Yeah.
no time.
Fine.
The bed's here, the clothes are over there. It's too much of a reach.
No, okay. Are you not worried about infections though?
I am.
Yeah.
But I know the Lord's got me.
No,
So, yeah,
no,
in a
darling.
sense,
We can't. The
I
Lord
know.
is great. Yes, you know, but we can't rely on that.
I
Okay.
know, yeah.
So especially if you're having sex with men. So men who have sex with men are more likely to test positive for infections. Yeah. Gonorrhea is on the rise. Syphilis is on the rise. Chlamydia is on the rise.
Hopefully I ain't got nothing. I feel like I just got luck on my side and good genes. I don't know. Like even like I feel like if I did impregnate a girl, like every time I'd have kids as well. I feel like I got super cum.
Are you all straight? Bi? No?
Bisexual,
Okay.
pansexual, whatever you want
I'm
to
the
call
only
it.
straighty. The only straight in the village today.
I'm bi. Yeah.
Are you?
Yeah. If someone can stimulate my mind and we get talking, that's it.
What if they're shit in bed?
Oh my God, what a horrendous question.
I like to think I'm quite good in bed, and I've been told I'm quite good in bed. Do I have to give myself out of a 10?
Oh, 10. I always ask them as well. I was like, how was that?
Straight up 10 out of 10. I mean, look at me. I would like to think I'm a 10 out of 10.
I'm so lazy, so I think I'm probably like a 5 or 6.
Yeah, you're definitely a 10 out of 10.
I guess.
I'm really good. I've gotten like great feedback.
There's room for improvement, but do we need it?
Obviously an 11.
Anyone into weird sex or?
I love guys in football kit.
So do you dress people up?
Yeah.
I get it though. I think footballers are
How about
sexy.
you?
I'm a rough sex kind of girl. I like being choked. I once someone once bruised my collarbone from choking me. That was fun.
What about yourself?
Am I into any weird shit? I really like the idea of meeting someone, falling in love with them, and then like having loads of nice sex.
Oh no,
Which
that's
seems
really
like a
sweet.
kink in itself these days.
yeah.
Everyone
that
just
is
wants you to be like fisting and shitting on people. Yeah, yeah. I'm extremely open. Too open, probably. I do wax, but I like to look like I'm of an age that I can have sex. One time I went and she just started taking it all off. She was just chatting away to me and I looked down and she'd literally left me with like a tiny like moustache above my clit, like a little Hitler tash. So I call it the clitler. I'm surprised by the amount of guys that you're doing the deed. And they just think that they're allowed in there without anything on the end of it. No, sir, get out. Did that say yellow room?
Orange.
I was on a man ban because I was a thirsty ass hoe for a long time. So I did the celibacy and then I had sex with someone for the first time. So I'm visiting the clinic today to see if I've got an STI. Hello, I'm Kat. Nice to meet you.
Nice to meet you. Take a seat.
Thank you.
So, what's brought you into the clinic today, Kat?
I'd like an STI test, please.
Yeah, of course you can.
Yeah. I think I gravitate towards guys that are quite obviously seeing loads of different people.
Okay.
I've had an incident where something could possibly have been passed on.
Right, okay.
Because condoms always used during sex.
Yeah.
When a willy's in your mouth, it wasn't on there.
No, that's
so I just
fine.
want to check.
Yeah.
Can't make babies that way, still can catch as a thing.
No, that's fine. So talk to me about this situation that you're worried about. Was it with a regular partner or someone you just
It's someone that I
with?
just started seeing. It was our first sexual encounter.
Yeah.
Then told me afterwards that they had something. So I was like, oh, bro, thank you.
Okay, cool.
Yeah,
And what
yeah.
was it they said that they had?
So they had an outbreak of herpes,
Type 1 herpes.
which wasn't active at the time, but
Okay.
had been diagnosed a little bit prior to.
So herpes, essentially, herpes simplex virus is a skin infection. So the main route of transmission is skin-to-skin contact. Now, because the majority of the time when we have sex, that's the biggest amount of skin exposure. So it's not exclusively sexually acquired, but that's majorly the way that it's transmitted onto somebody else.
Genital herpes is passed on through vaginal, anal and oral sex. It's known as the gift that keeps on giving because while herpes clears up on its own, it can come back at any time. Symptoms are small blisters that burst to leave red, open sores around your genitals, anus, thighs or buttocks. If you feel tingling, burning or itching down below, or pain when you pee, get checked out, even if you've not had sex for a long time, because blisters can take months or years to appear.
Now, there is no test for herpes, so we can't screen somebody to see whether they've got it or not got it. How we generally diagnose it is wait for somebody to have symptoms, they come in, and then we do a little swab of a blister. It's the liquid in the blister that makes it infectious. Or if he's got asymptomatic herpes, it will come to the surface of the skin for about 10 days per year. So if you ever feel tired, drawn down, any blisters pop up, get to your sexual health clinic and then we can do a swab and just check whether they're herpes or not.
Fab.
Beautiful. So what I'm thinking today is we'll do a blood test for HIV syphilis. And we'll also check for hepatitis B, hepatitis C, and then we will do some throat swabs for chlamydia and gonorrhea.
Cool.
Does that sound all right?
Yeah.
Should we head on over to the couch?
Do you have any symptoms today?
Next door, Sarah's getting to the bottom of Khayda's problem.
So basically, like from time to time, in between like my bum cheeks, like underneath the skin, I get like these lumps, but they disappear. So one of them might have it on one side and then it might disappear to the other. And then it will get closer to on top of like the line of my crack sort of thing.
Okay.
And it will move around and maybe some of them will get even closer towards the hole.
And are they painful at all?
Can be, but can be uncomfortable. So it depends on how I'm sitting and where I'm sitting sort of thing. So it's even when I'm lying down as well, it can be a little bit uncomfortable too. And a bit sore.
So they're a little bit sore?
Yeah. I don't know what I would call them, but
Right.
I can pop them and pus usually comes out, but they come up way too frequently.
Hey guys.
Hello. How are you?
New arrivals Elle and John are visiting the clinic together.
Are you a couple?
Yes. We are indeed.
Damn it. Love hairy men.
Amelio and Olivia are waiting for their full sexual health screens. And 29-year-old Kat is anxious to find out if she's picked up an STI.
Job well done. If you take a seat for me back in the waiting room.
Cool.
What's the weirdest place both of you have had sex?
Probably behind a beach hut.
Mine's kinky as anything.
Go on.
It was me and a police officer at the back of the station.
Hiya, you alright?
Hey. How's it going?
Hello.
Good.
How are you?
Yeah.
I like having every kind of sex you could ever possibly have. I like big dick, but who doesn't like big dick? But I like women more than I like men. I have come to the clinic today to basically find out whether you're more susceptible to catch things being a bisexual woman.
Hello.
What are the risks when sleeping with both genders?
That's a really important question because a lot of it depends on the kind of sexual behaviours that you get up to.
Yes.
So kind of paint me a little picture.
I would never say no to anything.
Yeah?
I'm more like romantically interested in girls because I think girls know what girls want and girls like we have a lot of feelings, we can be more passionate. And most of the guys that I've been with are very just like, I'm just gonna fuck you. And I'm like, okay, that's what I want.
So generally, a lot of STI transmission takes place between heterosexual penetrative sex.
Okay.
So in the case of your situation, women who have sex with women only make up about 3% of all STIs.
Okay.
But what we generally find is things like BV and things like TV and thrush are much more prevalent in sexually active women.
I haven't been tested in quite a little while.
Okay. What I think we'll do today is part of the full sexual health screening is do a swab, take a little look under the microscope and see if there's anything sort of there that maybe shouldn't be or that we can offer you some treatment for. Dr. Naomi, this is Olivia. She has male and female partners.
Last swab from the vagina, darling.
Yeah. Oh, I feel like I shouldn't be laughing.
That's all done, darling.
Thank you.
So I'll get you to sit here for me, Khayda.
20-year-old Khayda is about to find out whether the lumps on his bum are symptoms of an STI.
So I'm going to get you to turn to your right.
Yeah.
Yeah, and we're just going to have a look at the skin at the back there, yeah? Bring your knees up to your tummy for me. And I'll just get you to hold open for me there. Perfect. Okay, so let's have a look. So you said normally it's around the...
Yeah, like this. There was
perianal
one, like,
area.
Yeah.
So around this area
There's
here.
one here, like here.
Just mind your finger for me so I can have a look. Just here, yeah?
Yeah.
I can feel a little bump there. Okay, that just looks like a trapped hair follicle.
Oh, okay.
All right, the skin's not broken. It's definitely not anything related to an STI. Whatever you do not pop it.
Oh, okay.
I know sometimes it can be like when you get a spot, you think, oh God, if I pop it, then it's gone. I don't have to deal with it.
Yeah.
A lot of times, what can happen is it can become infected, and loads of parasites and fungal bacteria can cause it to just get a little bit more aggravated if you pop it. So just leave it. To the symptoms that we were talking about, your trapped hair follicles. The best way to deal with them is to avoid shaving, okay? If you are going to get rid of your hair, waxing is better, or just trim the hairs, okay? Because when you shave it too close to the skin, and what happens is the hair goes back on itself and it grows on the inside, causing the bacteria to cause an infection. Now, I know you also like a good pair of skinny jeans, show all those curves off, right? Now, if you do have an outbreak where they come back again, avoid wearing clothes that are too tight. Okay? So just no shaving. And if you're going to cut your hair, don't cut too close to the skin. All right? And just exfoliate.
Okay. And I was very afraid, thinking it was like some disease, like no one don't have, but I might be the only one with it. And the fact that she told me that it was actually just ingrown hairs, it's like, oh God, it's only hair. Like, I feel like her weight's lifted. So now I'm going to take better care of myself.
Doors closing.
I'll put myself out there. I'm quite a freaky kind of gal in a bedroom. When I first get into a relationship, I'm always a bit like, oh, do I tell them about the kinks that I have or what I like? When you got together, was there anything that you were like, I'm not going to tell him until we've slept together?
I had quite an inkling and quite almost a fetish for feet, I suppose.
Oh, okay.
So when I
Do you? Oh my God, talk about it.
So
You found someone
Do you want to come to this side?
Yes, he's found someone else.
Did you tell her straight away?
not straight away, no.
Fair play.
So I kind of
Bye.
so
Bye.
I didn't want to scare her off. Do you know what I mean? So yeah, I kind of broached the subject, and she was kind of like, absolutely not. You're not touching them. You're not even seeing them. Like I wear socks in bed. Like what the whole works.
Ooh.
The golden shower, peeing on people.
Maybe a foot job, if I've had a few drinks.
Don't ask, you don't get.
Hair pulling.
Hair pulling.
Give it love bites.
Fucking a guy, in the arse. No one's let me do that.
The ones I leave, they look like a vampire's just drained your blood, literally.
Fisting!
I've got a thing for butt plugs at the minute.
Had sex with this guy I didn't know, and he shoved a butt plug in my asshole. That was great.
So how did you two meet?
We worked together, actually, in a pub. My first shift, I was a bit like, ooh, who's that pretty boy behind the bar?
The very first indication I had that she might be into me was actually you had to kind of get up and squeeze around the side to get to the bar. It's really weird.
Oh, she grabbed your
Very drunk.
No, almost. She bit it.
Good girl.
He helped me carry some heavy barrels, take the bin out, and then obviously started flirting and away we went.
So what are you both here for?
It definitely hurts when we have sex, more in some positions than others.
Yeah.
So obviously we just don't do it when it bloody hurts. Me and John, we've been going out for over 1.5 years now. He treats me so well. The relationship is so lovely. But when we have sex, it hurts. So obviously it does affect it.
Do you get turned off, in the moment?
When it hurts.
When it hurts.
Do you have to restart, or how does that process work?
I don't want to be a selfish little bitch, so I kind of just grin and bear it.
I want her to be okay, and the end goal for me is I want to have a family with Elle and kids and marriage, etc. So it's definitely a worry. For me, obviously, I can tell that it bothers her quite a lot, and so I'm always conscious of it.
Does it ever turn you off, so you end up going?
Occasionally, yeah, but more so because I know she's not enjoying it. So
yeah, that's what I mean.
I like to know if she enjoys it. That kind of turns me on more.
It's nice that John's actually come with me to support me. Hopefully, I'll be able to get some sort of answers as to why it hurts when we have sex.
Hello. Come and have a seat. I'm Dr. Naomi.
I'm Elle.
Elle, lovely.
Yeah, lovely to meet you.
And you? How old are you now, darling?
I'm 21.
And how can we help you today?
It's getting quite painful to have sex.
Okay.
Quite painful. When I was younger, before I started taking the pill, I used to have very bad, like period pains to the point where like I'd be in tears.
Yeah.
I started having like stomach pains like probably about 4 years ago, and I went to the doctors and they said, oh, maybe just start taking the pill to regulate your periods more.
So when did you start taking the pill?
Probably about 4 years ago.
Was sex painful from the very start?
Like sometimes it hurt, but like it wasn't every time.
Yeah.
Recently, it's like nearly every time I have sex now, it's very painful.
And how does that affect you?
It's a bit like, that actually really hurts, like can we not do that? Sometimes when we have sex, it hurts more in different positions than other positions. So obviously it does affect what we can do.
Do you have to stop?
Sometimes, yeah, it just makes me want to cry. I don't want to do it if it's just going to hurt me.
Okay. And are you with a long-term partner at the moment?
Yeah.
And how do you think that affects you and your partner?
I don't think he says it affects him, but I think he's probably a bit like, why don't you want to have sex as much? Do you know what I mean? I think it's more like he's thinking it rather than we'll voice it.
When you say it hurts, what percentage of time would it be painful?
Probably about like 80%.
Okay.
Yeah.
Whereabouts does it hurt?
Like right inside.
So it's a deep pain?
Yeah.
So it's not painful on entry of the penis into the vagina, it's more of a deep...
Yeah, like the other day, like it was particularly bad, it was like burning almost.
So burning within the vagina?
Yeah.
Okay. I'd suggest you might have endometriosis.
Endometriosis is where the tissue that lines the womb, known as the endometrium, is found outside the uterus. It's a long-term condition that affects 1 in 10 women. Symptoms include heavy periods, painful sex, nausea, constipation, or diarrhea. It can also affect fertility. There is no cure, but the condition can be managed with painkillers, hormones, or surgery.
So this service isn't the right place to diagnose endometriosis. So I definitely would see your GP and ask to be referred to gynaecology, because the only way to diagnose endometriosis is to do a laparoscopy. Do you understand what one of those is?
Is the camera in your belly button? Yeah.
Yeah, perfect, yeah. Now, one thing to do which may help is to take the pill back to back for at least 3 months, and then just have a shorter break, so a 4-day break, and then carry on. And it may just keep the endometrium so thin that it causes less problems.
Okay.
You know, you're young, and actually the longer you leave endometriosis, you know, sometimes it can get worse.
Yeah.
Would it help, I'm thinking, to see one of our sexperts just to discuss positions and other ways to sexually pleasure each other? And you could even do it together as a couple if you think that would help.
Yeah, that would be great.
Excellent. So if you have a seat in the waiting room, we'll call you back.
All right, thank you so much.
All right.
To hear from a professional has made me feel reassured that I'm not going crazy. I'm back.
Do you ever look at someone and feel like, oh...
I'm just gonna fucking do you. Yeah, all the fucking time.
All the fucking time.
I could literally be on the bus and I'm sat there like, do you?
Yeah.
Like, do you think about it quite a lot?
Yeah, quite a lot.
All the time?
And it depends who walks through the fucking door.
You're like, next.
My name's Amelio and I'm from Derby. I studied a degree in fashion promotion. I love to be licked out.
Tell me about it.
That's fucking amazing.
There's
Feels amazing.
this one guy.
And I've done it to so many straight guys and they've been like, wow. I have quite a lot of sex and I've got a high sex drive. Very high sex drive. And it takes a lot to please me. It depends on who I'm seeing. I could have like 3 people in a day sometimes. Hello.
Hello, how are you?
I'm good, thank you.
Lovely. What's your name?
Amelio. God, your lashes are on fleek.
Thank you. Babe, I was just thinking about the same as yours. I'm like, okay, I thought I had eyelashes on today. When's the last time you had a sexual health screen, Amelio?
Roughly around 2 months ago.
About 2 months ago, okay. And what's your sexual orientation?
Bisexual.
Bisexual. Are you in a relationship at the moment?
Fully single.
Fully single. Is that a good thing? Are you happy about that?
Always.
Or is it always a good thing?
Yeah, yeah.
Okay. So you're not the relationship type?
No, definitely not. I like to play.
You like to
There's
play?
nothing else to say. Like, I'm a quite adventurous person.
Okay. Have you always been that way?
No, actually. I used to be like, when I was at school and stuff, I was kind of like the quiet person. I was the boy at school that like people didn't like, and I got bullied for my looks and all sorts. I've just changed and become this like animal. I feel like I think about sex too much.
Oh, really?
Yeah, I feel like it is a constant thing.
Give me like a number. How often do you think about sex? Is it like in the shower, on the tube?
It is constantly. It depends who I'm thinking about.
Do you relieve yourself? Do you masturbate quite a lot?
Yeah, I'll masturbate. Some days I can sit at a computer and I'll be busting one out 6 times a day.
6 times a day?
Yeah.
Okay, it's quite a lot.
Yeah.
Are you not exhausted?
No.
No?
No.
You can just keep going with it?
Within an hour, I'm back again.
Reload?
Reload.
Yeah?
I might bring people over so I won't have to masturbate.
Okay.
So then it just turns into sex.
Yeah.
But I'm always swapping and changing all the time.
So you're constantly changing partners?
Yeah.
Okay. So are you finding that you're taking more risks? So because you're constantly horny?
I do feel like that way. Like,
why do you think you are having a lot of sex?
I actually don't know. I just feel like it's not exactly a factor of, oh, do I need to be loved? Do I need to be that? Do I need to be that? It's nothing to do with that. It's just like attraction, based on attraction purposes.
I mean, the feeling of being horny all the time in itself is not a bad thing, okay? It's not a problem. It's what that can then lead to. So then if that means that you're having more sexual partners, so obviously the more people you have sex with, the more likely you are to catch an infection.
Next, into the waiting room.
Hi. You need to sign in.
Is 25-year-old Conor. Bisexual Olivia is waiting for her STI results, as is Singleton Cat.
Has anyone ever been fisted?
Nope, nor will I ever be.
Lovebirds Elle and John are waiting to see the resident sexpert.
Hello.
Do you reckon you could figure out which one of us is straight?
Him.
Yeah, obviously.
Well done!
Yeah.
Got it in one.
Okay, so I'll get you to hop onto here for me.
Amelio has been a busy boy lately, so Sarah is giving him the full set of swabs.
They are.
In the throat,
That's it.
the penis,
So it's a little bit dry.
and the rectum.
Finished.
I'm going in. I hate condoms. I've had STIs before. I've had chlamydia and gonorrhea. Obviously, there are moments when you're in the moment, you don't use protection, which is really bad. And then obviously it plays on my mind after. I'm like, oh God, I should have used protection.
Your last checkup was 3 months ago. Have you had any unprotected sex since then? Yes. Yes, okay. When was the last time, roughly?
A few days ago.
What we'll do is we'll get you on the couch, we'll do some swabs.
Okay, fab.
This is your modesty blanket.
Oh, thank you.
Hope it's big enough.
Just gonna have a little look. That is all done.
That was all right.
We're finished then, so if you have a seat in the waiting room and we'll call you through when the results are back.
Okay, cool.
Okay.
Hi guys, you alright? So what are you here for then?
Just a checkup, STI checkup.
Yeah.
And what about you?
I've checked quite a few girls since the last one, so I think it's about time I get checked, to be honest.
Still straight then?
Yeah. Are you gay?
Yeah.
How many girls have you shagged then?
Just 2.
Just 2?
Yeah. What about you?
It's our number.
A lot more than 2.
Oh.
No one's getting that information.
There's a few, you know.
Oh no.
Maybe over 25? God.
My nickname's 50, and I got that years ago. 53, I think it is. Yeah, a handful maybe.
130 people?
I'd say around 80.
Well over 100.
40, 50 people.
Over 15 people.
9 people. 5.
Yeah.
It's too many, yeah, too many.
Have you ever been with a girl?
Yeah.
Have you?
Been with a few girls, yeah. I don't mind it.
Yeah.
I just prefer the penis.
Fair enough.
And I like straight boys as well.
Yeah. I found that because I'm a butler in the buff. So, yes. But, yeah. So I go to, there's a lot of like gay people sometimes at hen do's and stuff. Mm-hmm. The general vibe is they like straight boys. Don't know why.
Yeah.
Yeah, why is that?
It's just a challenge, isn't it?
Is it? Yeah.
Do you get a lot of guys hit on you then?
Oh, yeah, a lot.
Yeah, I can imagine.
A lot, yeah. is what I wear for Butler in the Buff. You got your little bow tie, you got your little apron on, got the good old arse out. So at the hen do, obviously you've got to give the bride attention because you're there for the job, and then you mingle with everyone. But then you start to focus more on the fit one that you want to shag, and you kind of go down that route basically.
So, do you tend to use condoms or?
No. I can't get it up. I'm not to like blowing my own trumpet or anything, but I think I've got quite a big penis. Right. So when I put a Johnny on, it's like strangles it. I can't get it up.
Yeah, I really want to see now.
I couldn't tell you everyone I've shagged, I can't remember. There's sometimes on nights out and stuff when I see a girl and I think, have I shagged you? I don't know. Oh, fucking hell, it's me. It's a bit of doubt every time I go and get tested, just because, you know, I shag a lot of girls and a lot of one-night stands, and the type of girl that's going to have a one-night stand with you is going to have a one-night stand with someone else, and she's probably got something.
Hello.
Hey, you all right?
Hi, come and have a seat. I'm
Nice
Dr.
to meet you.
Naomi. And you're?
Jacob.
Jacob.
Yeah.
How old are you now, darling?
20. Just come for a screening, really.
Okay.
Yeah.
Have you been before?
Oh yeah, I've had loads of STI tests before, but it's been a while. I've shagged a few girls since then, so far.
Okay.
May as well.
When was the last screening?
3 months ago,
Okay.
2.5 months ago.
You said you've had sex with a lot of girls since then.
Yeah.
How many are we talking about?
I don't know, lost count.
Okay. And where are you meeting these ladies?
I'm a Butler in the Buff.
Wow. Okay. So about how you find all your ladies then?
Yeah. I love doing the body shots.
Okay.
Do it every job.
What is a body shot?
They straddle you.
Right.
They lick their choice of alcohol from there to there, and then they've got to do a shot from your mouth. So you've got a shot glass in your mouth with the alcohol in it, but they're not allowed to use their hands.
And has anyone specifically asked you to have sex from that?
Yeah.
Okay.
And a half. I love shagging after a job, it's great.
Have you had any long-term relationships?
Yeah, it was, I was with a girl for 2.5 years.
Okay.
We broke up like 2 years ago. In the relationship, lost my virginity to her. Took her for a birthday, and then she looked me in the eyes and was like, oh, I don't love you anymore. I was like, what? Fucking kills me. So I went on a massive shagging spree, basically. And I shagged like 52 girls since then.
So that's quite a large number of partners for your wee age of 20.
Yeah. I went through a phase of shagging like 2 or 3 a week for a good 8, 9, 10 weeks. Absolutely rinsing through it.
Condom use, the big question.
Very bad.
Okay.
Very bad.
Very bad.
As in, like, I barely ever use one.
Why don't you use it?
I can't get it up when I use it, and I feel like I'm shagging a bin bag.
Okay. So have you had problems keeping an erection with a condom on,
Yeah.
hence you just don't want to use it?
Yeah, it keeps going up and down. I'm like, oh, fuck it, and then it just feels 10 times better without a condom, I think. I'm very bad for wrapping up. I have been quite lucky, though. I haven't learnt my lesson. I'm still not using a condom.
So what I'd like to do is do a swab from the urethra.
What's that?
The tube that you wee from.
Down there?
Yeah.
Nope. It's not happening.
No?
Nope.
If you're not comfortable with having a urethral swab, we can send a urine.
Yeah.
The benefit about the urethral swab is there's a fast turnaround of 20 minutes.
Yeah.
I guess the downside of the urine is that it'll take us a day or so to process the results. Is that okay?
Yeah, I'm patient, don't worry. I'm not fancying something down there.
Okay. What I needed you to do me a urine sample, the first bit of wee into that pot.
Cool.
So when was the last time you got tested?
I'm actually G1 now anyway,
Okay.
which is great. I did have an STI before.
Do you mind asking what it was?
It was chlamydia. It was chlamydia, yeah. I've had gonorrhea before as well, but you just an injection in the butt cheek and then, like 4 tablets. I'm like, oh. But
that hurts to sit down after a while.
Well, I mean, I take out the arse quite a lot anyway, so it doesn't really matter to me.
Woo! Have fun! Away we go.
Elle and John are hoping to get back to business in the bedroom with a visit to the sexpert.
Since meeting like John and having like much more regular sex, it's starting to hurt quite a lot. It's not gonna hurt. I don't want it to. I'm Alex. Lovely to meet you.
Lovely to see you.
You all right?
Have a little perch on my bar stools.
Thank you.
Now, are you finding normal intercourse to be a bit more ouch than wowzers?
Yeah, it's definitely in the last few months it's got a lot more painful.
Endometriosis, if that's what it turns out to be, it's not uncommon for that to cause pain. Do you find that there's any positions that work well for the two of you or that aren't so uncomfy?
Probably one of the better ones is when I'm on top.
Right.
Because I'm more in control of where it's going
Yeah.
and how much it's going
You
in.
can angle the dangle.
Yeah. I like that, angle the dangle.
And then you're more in control of the depth as well,
Yeah.
or if you need a break, you can go a little bit more shallow.
Yeah.
Some people find that plain old missionary is actually the most painful for them because it tips the uterus back.
I found that whenever we've kind of been in the missionary position, it's always hurt her a lot more. But I'm always quite conscious that it's painful for her.
One thing that can help is lube. Loads and loads and loads and loads of lovely lube. Because any friction that is pulling on your vaginal canal is going to pull anything that's connected inside of you, any of those endometrial growths. The more you can make your foof like an ice rink, the more you can make it glide, the more that things will be comfy for you. There are going to probably be times as well where you just don't fancy penetrative sex at all. There's still a ton of fun that you can have. There's loads and loads of options so that you don't think endometriosis is the end of your sex life. Just don't panic yet.
Don't panic
Loads
yet.
and loads of resources. Take care, guys. Thanks for coming in.
Excessive lube, it could actually really help the pain of my maybe endometriosis because it's making it a lot slippy slidey.
It meant a lot that I could be there.
It's fine to sit and talk about things with your partner.
The more you do it, the more kind of you understand each other, you kind of learn about each other and you can help each other. So it's definitely an important aspect of any relationship, communicating with each other for sure.
Definitely.
Doors closing.
Can you imagine if you come up with an STI?
It's nerves all round in the waiting room as they wait to hear the results of their STI tests.
There'll be nothing there. I'm confident.
You can't say that. You can never trust anyone 100%.
I feel quite confident.
Was you going to be okay?
Yeah.
You could sleep with one person or 100 people, and that one person could give you something, and then 100 people couldn't.
Oh, I'm dreading it.
Are you?
I'm literally going to be absolutely mortified if I have an STI.
Oh my God.
Good luck.
Results.
Good luck.
How are you?
So I'm fine, thanks. Come and sit down.
How have you been?
Good.
Yeah? Anxious?
Fingers crossed, don't jinx it.
So we did some testing on you. Your results came back for the chlamydia and gonorrhea as being negative.
So the things we've been able to test in this short time frame is the bloods.
Yeah.
So we looked for HIV, which was negative.
Yeah.
Syphilis, which was negative.
Yeah.
Hep B, which was negative.
Yeah.
And Hep C, which was negative.
Cool.
So all good news.
We also did a blood test that was testing for HIV and syphilis.
Yeah.
Those came back negative as well. A clean bill of health from the clinic
Squeaky
today.
All right.
Bye-bye.
I'm absolutely pleased that I'm clean. Clean as a whistle.
I've got your results from your sexual health screen. So from your blood test, I tested you for HIV, syphilis. They have both come back as being negative, so all good there.
Yeah.
We did some swabs that were checking for chlamydia and gonorrhea. They've come back as all negative as well.
And we've sent the urine away for gonorrhea and chlamydia, so
Yeah.
we can phone you in the next couple of days for those results.
Yeah.
So, take-home message
Yeah.
is what?
Wear a condom. I think I will chuck a Johnny on, hopefully. Might have to pop a Viagra though to keep it up. See you later.
Bye.
Bye bye bye.
So in my jar of souvenirs, please help yourself.
Oh my gosh. I think it's been very affirming that I'm making the right choices. I'll put one in each tip.
One in this one.
Yeah. Yeah. Bye-bye,
All right,
thank
darling,
you.
bye.
Even though there's a fear surrounding going and get testing,
Doors closing.
if you're going regularly, there's going to be less chance that you're going to have something to pass on.
The tension is mounting for Conor and Amelio as they wait to be called in.
Hello.
Hi.
Welcome back.
Pleasure.
And how are you feeling about your results today?
I feel actually quite positive.
I've got your results here. Your syphilis has come back as being negative, and your HIV has come back negative as well.
So remember we did a blood test?
Yeah.
Perfect, so that's come back negative for HIV and syphilis, okay?
Yeah, that's fine.
We did swabs from every single site for chlamydia and gonorrhea, and they all came back negative.
Okay, I literally was going to say positive there. Okay. Okay, thank you.
So moving forward, how are you going to keep your results negative?
Just have to be more cautious and make sure that they're always protected. I'm always protected. I've just got my results. I'm all good. Thank you so much.
Great to meet you.
I think now that I'm getting older, I think I need to take more caution, make sure that I'm or them are always protected.
Doors closing.
And remember, we also did some swabs.
Yeah.
Yeah. So in your throat, we did a swab for chlamydia and gonorrhea, which was negative. You tested negative for gonorrhea in the rectum, but we did detect chlamydia in your rectal sample.
Right, okay. So what does that mean then?
Okay, so that means that we tested you for chlamydia and gonorrhea.
Yeah.
The chlamydia has come back positive. So what that means is that you would have contracted chlamydia anywhere from 2 weeks ago.
Like, could you be passed on through oral?
No.
No.
It doesn't travel, so you can't get it in the throat and then it's going to travel to your penis or your rectum or anything like that. It doesn't work in that way. The only way that you would have caught it in the rectum is by having sex with somebody who didn't wear a condom.
Yeah.
Chlamydia, street name the clam, is a bacterial infection passed on via unprotected vaginal, anal or oral sex, unwashed sex toys and even infected bodily fluids getting into your eye. It's one of the most common STIs in the UK among young people. Symptoms in men include pain or burning when taking a leak, discharge from the end of the penis or back passage and testicle swelling. You can also get it in the throat and eyes. It can be sorted with antibiotics, but if ignored, it can affect fertility. Symptoms don't always show up, so it's important to get tested regularly.
So condoms are the best way to protect yourself against STIs, okay? There's loads of different condoms that you can pick off the market, but there are some that are much thinner than others. You can sort of feel the sex a little bit more. So it's it's as close as you're gonna get to having unprotected sex. Those are the type of condoms. So based on today's results, do you think you're likely to change, your approach to sex and
I just need to always wear a fucking condom in order to protect myself and be like, look, if you got anything, can you please tell me instead of like, let's just go for it.
And have that
I just need to
conversation.
be and just talk about it more.
And I think when you ask your partner, okay, when's the last time you had a sexual health screen, they're more likely to trust you as well because it shows that you're a responsible adult. You know, you're asking about their sexual health. And also nowadays, you get your results texted to you. So you can just say, look, when's the last time you had a screen? Do you have the text messages so you show your results? And that's a good way.
That's wicked.
So what we'll do is go through how many partners you've had in the last 6 months. How many are we talking?
7.
About 7 partners, okay? You're gonna inform all 7 partners?
Yeah.
Lovely.
100%.
Chlamydia is the most common infection that we diagnose every year in the country, okay? So the treatment is very straightforward. You're gonna take a week's antibiotics. I mean, it's completely clear.
And then it's gone?
Yeah, exactly. Okay, so here's your antibiotics, darling. No sex for 7 days, you promise me?
Yeah, I promise you.
All right, perfect. Okay, and we'll see you in about 6 months. If, of course, you have any questions or any symptoms or anything you're worried about, come back to us.
Wicked. Okay, pleasure.
Nice to meet you, Amelio. Get home safe.
Will do.
All right.
Pleasure. Thank
Bye-bye.
you. Bye. I was expecting, obviously, to be full negative, but I did have chlamydia. It's just prepped me more to be extremely careful. So I think I'm just going to invest in loads of condoms, basically. After today's result, I'll go to the clinics every 3 months because it's better to catch something earlier than later.